Hey, Dr. Jereme at Balance Within Physical Therapy, and today I want to give you 3 tips that will help you with alleviating sciatica pain quickly. Now, when you're looking at sciatica pain, oftentimes it can be a multitude of factors. Oftentimes you might have some tight muscles, but there's oftentimes going to be weak ones involved with it. So this video right here is going to be more so going after the tight muscles, which will give you more of an instant relief for this, where you're looking at strengthening the muscles to get more to the long-term relief of it and staying on top of it. So for this exercise here today, what you're going to want to use is either like a softer ball or a tennis ball, or one of my favorites is if you have 2 tennis balls taped together or put together in a sock, which allows you to have just a little bit more surface area to work with these guys. So first area that we're going to work with is going to be in our hip and our glute region. There's a muscle called the piriformis where the sciatica nerve runs directly behind it. And what you're going to be doing then is, whether ball is going to be this one or the tennis ball, you're going to put that right underneath there and be rolling around until you feel that really tight spot. And once you get on that, you're pretty much going to know where that is. You're going to hang out on there for as little as 30 seconds, but ideally it can take up to about 2 minutes or more to get a little bit more of a deeper release into the muscles. So as time allows into it, try and hold it for a minimum of 2 minutes. If it is hurting your back to be in that position, you can always do this with your back supported as well, and just put the ball underneath there. Second area would be going directly into the low back itself. There's going to be a lot of tight muscles back there where that nerve exits the spine and turns into the sciatic nerve. So with this exercise here, oftentimes do recommend the tennis ball works a little bit better. This one you can either do laying down, or you can do this standing up against a wall. So as you put the ball underneath there, you're going to feel for something that feels like a knot or a rope, tolerable tenderness, and maybe even hurts good. And you're going to hold for around a similar amount of time, minimum 30 seconds, but oftentimes it's going to take usually a couple minutes to get more of a deeper release into it. If this is too intense, if this is too painful, you can put this ball on a bed and do this on a softer surface, or use a softer ball. And then the other spot we're going to be looking at is our hip flexors. Now those are more so on the front side of our body, but they do have attachments on our lumbar spine. So oftentimes these areas can be missed, and also large players in a situation where someone is dealing with sciatic pain. So for this one right here, we're going to use a ball on the front side of our pelvis here. So we find our pelvic bone, and it's going to feel kind of just a little bit harder, and then you kind of come into where it becomes softer. That's where that ball is going to be. And then you're going to lie on your stomach with that ball in place. Again, feeling for things such as it hurts good, it feels like a knot, it feels like a rope. And you're going to be holding that for minimum 30 seconds, but ideally minimum 2 minutes to get more of that deeper release into it. For an individual who may have some pain in their neck or shoulder region with this, they may need to have their arms crossed and kind of just let their head rest on the ground, just so they're not straining any area up here while they're getting their releases down in the sciatic region for those 3 areas. So again, summarizing: low back muscles, the QL, the piriformis, the hip muscle, and then the front side muscle is the hip flexor. So work on these, and oftentimes this will be a wonderful recipe to get out of pain really quickly with sciatica. But use these to your advantage. These work very well, and until then, be well.